Minister Maria Caulfield.
Thank you, Madam Deputy Speaker. Can I start by just thanking everyone from all sides of the House who've taken part in this debate this afternoon. And the Shadow Minister is quite right that this is an issue that unites us all and puts politics aside. The loss of a baby is never easy to discuss, whether it's the loss of your own baby, a baby known to you, or the experience of a constituent. It's a hugely emotional and sensitive area, where time often isn't the great healer it's made out to be. And this debate has raised some difficult but important issues. I just want to start by particularly thanking the co-chairs of the All-Party Parliamentary Group on Baby Loss, the Honourable Member for Truro and Falmouth, with her experience of losing baby Lily, just spoke extremely bravely. The Right Honourable Member for South West Surrey, who also helps to secure this debate. And I think the response and strength of feeling shows how many lives have been affected and touched by this issue. There have been so many moving contributions, I can't name them all, but contributions from the Honourable Member for Pontypridd and the Honourable Member for Bracknell, and also the Honourable Member for North Ayrshire and Arran, talking about baby Kenneth. Now, this is the 6th year that a debate has been held to mark Baby Loss Awareness Week, and I'm honoured to take part as the new Minister for Primary Care and Patient Safety, and to work with all honourable and right honourable members across this House in making a difference in an area as vital and as important as maternal and neonatal safety. It's perhaps fitting that this debate is happening so soon as I have taken on this role, as it has sharply focused my mind on the huge amount of work there is to do in improving the outcomes for families and babies. The government's maternity ambition is to halve the 2010 rates of stillbirth, neonatal and maternal deaths and brain injuries in babies occurring during or soon after birth by 2025. The ambition also includes reducing the rate of preterm births from 8% to 6%. And we are making progress on this, as since 2010 there has been a reduction of 25% in stillbirth rates and a 29% reduction in the neonatal mortality rates for babies born after 24 weeks gestation. There is, however, progress to be done on reducing maternal mortality rates, brain injury rates and the preterm birth rates, which has been slower than any of us would hope. But there are pilot schemes in place, such as those introduced under the Brain Injury Reduction Programme, which saw £9.4 million worth of investment during the spending review last year, going towards reducing incidents of birth-related brain injuries. The pilots will produce cutting-edge training and expert guidance, and I will hope to report back to the House on their impact. Now, my honourable friend from Truro and Falmouth raised some incredibly important points, and I want to touch on a few of them. Firstly, on the investment going into maternity services. Of course, financial investment can make a difference in improving maternity services. And NHS England announced earlier this year an additional £95 million of recurrent funding for maternity services to support the recruitment of 1,200 midwives, 100 consultant obstetricians, and the implementation for actions arising from the Ockenden report. NHS England and NHS Improvement are also providing an additional £52 million to fast-track a long-term planned commitment for all women to be able to access their maternity notes and information via smartphones and other devices by 2024. But money is not the only solution here. One of the key ways to improve outcomes is to look at what has gone wrong in the past, and tools like the Perinatal Mortality Review Tool is key in doing this. The health departments in England, Wales and Scotland collectively fund the Perinatal Mortality Review Tool, so that deaths of all babies between 22 weeks gestation and 4 weeks old are reviewed in order to provide answers to bereaved parents about how their babies died, and so that the NHS can learn lessons and improve care. All bereaved parents now have the option to be involved in a high-quality review of the death of their baby. And according to the last Perinatal Mortality Review Tool annual report last year, 84% of review cases in England 86% of cases in Wales and 87% of cases in Scotland included parents in their final reports. It is by learning from parents, as we've heard today, and listening to their concerns that we will ultimately improve services for future families and save lives. Now, the Shadow Minister and my honourable friend from Truro and Falmouth raised the issue of tackling inequalities in perinatal outcomes from women from Black, Asian and other minority ethnic groups, because there are huge disparities in outcomes across different communities. Earlier this month, NHS England and NHS Improvement published an equity and equality strategy supported by £6.8 million worth of investment to address the causes of inequalities in health outcomes, experience and access. It provides guidance for local maternity systems and focuses on Black, Asian and minority ethnic groups who currently experience poor outcomes when it comes to maternal health. And this is a priority area for me, and I very much take the points of my honourable friend around the importance of continuity of carers. Now, in supporting bereaved families when the tragic loss of a baby occurs, I am delighted to hear that we have reached the milestone of every NHS trust in England having now expressed an interest with SANS in joining the National Bereavement Care Pathway programme, and 65% of trusts are now members. We will continue to take a cross-government approach to assess what more needs to be done to support bereaved families. And I will discuss with my ministerial colleagues the points that the Honourable Member for Lanark and Hamilton East made in particular around leave for those who have experienced miscarriage pre-24 weeks. And it's important that the points that have been made about mandating the pathway and funding to ensure that every hospital has an appropriate bereavement suite and specialist staff and training. And I will feed back to the House on the progress we're making on this, as I recognise we need to move swiftly. My honourable friend from Truro and Falmouth also, as did many other members, commented on the mental health support for bereaved fathers, parents, families and siblings. And we heard from my right honourable friend from South West Surrey the impact of the loss of babies on the whole family and the impact of the loss of baby Sarah had on his. Losing a baby can be massively impacting on the whole family. And this government is committed to expanding and transforming mental health services in England so that people, including those affected by the loss of the baby, get the help and support they need. And we couldn't have heard more eloquently from my honourable friend from Guildford about the experience of not getting it right. We have a long-term commitment for a further 24,000 women to be able to access specialist perinatal mental health care by 2023, building on the additional 30,000 women who can access these services this year.
Will my honourable friend give way?
I will give way.
I thank her for giving way. Does she agree with me that actually all the things she's talking about are really what's needed is a really joined up set of Start for Life services such as the government is already putting out in its Best Start for Life work and which we're working so hard to implement now, and that if we could provide the continuity of care and the wraparound support for families, that so many of the problems of health disparities and indeed the terrible outcomes would be avoided.
I thank my right honourable friend for that intervention, because she is right. This has to be a whole family approach and a cross-departmental approach as well. And I very much take the points that she's made and hope we can look at that going forward. Now, the partners of expected and new mothers who are also face some of the stigma that we've heard this afternoon from many colleagues is something that I hope we can improve and offer a range of help, such as peer support, behavioural couples therapy sessions and other family and parental interventions. And it will be something that I will focus on going forward. Now, this year, unlike many previous debates on this issue, we have to touch on the issue of COVID, because this year, more than most, has been particularly difficult for those facing the loss of a baby. Because the COVID pandemic has had to mean measures have been put in place to protect healthcare workers, patients and the general public. And it's been particularly difficult for those who suffered baby loss during this period. but specifically around preventing maternal death and morbidity from COVID. Recent findings from a national perinatal study show that 742 women admitted to hospitals since vaccination data has been collected, 4 had received a single dose of the vaccine and none had received both doses. And this means that more than 99% of pregnant women admitted to hospital with symptomatic COVID-19 are unvaccinated. And one message I want to get across today is that it's hugely important that both mothers and their families are vaccinated to improve their safety. I will give away that point.
We've been pushing the JCVI to really make sure that pregnant women are part of any priority group. And will the Minister give a commitment today that if there is any booster programme, that pregnant women will be part of that priority group?
I very much take the Honourable Lady's point, and I think there was a lot of misinformation earlier in the year which often made women who are pregnant reluctant to come forward, and I think there's a lot of work we can do to improve the communication around that. I'd give away one final time.
I just wanted to raise a specific point around COVID that I learnt from a obstetric consultant who told me that the number of preemie births during COVID had dramatically dropped because women were at home, and there had been it was a doctor from Reading who told me this, that he basically had to be dispatched somewhere else in the NHS because his services in premature babies was no longer needed because the number had dropped so greatly because women were at home. And I wonder if that will form part of the strategy to make sure that in baby loss we are looking after women throughout their pregnancies.
Yeah, I think the Honourable Lady makes an excellent point, and we need to be guided by clinical evidence and clinical practice. And I think the period of COVID, we will look back and reflect on some of the lessons that can be learnt there. Just want to touch on a few honourable members, or many honourable members, mentioned the staff who look after women and families who've lost a baby. And it's incredibly important that we support staff because the impact is huge. And can I just put on record my thanks to every single one of those maternity staff who look after women, who look after families, because the toll on them is sometimes greatly underestimated. It's assumed because they go into that speciality that they can cope with this, but it's extremely difficult for them. And can I just, from my honourable friend from the cities of London and Westminster, also welcome Jane Scott and her colleague, one of the midwives from St Mary's, who has set up the National Bereavement Midwifery Forum, and I'd be delighted to visit them and learn from their experience as well. Because we are committed to supporting staff and making sure that they are able to undertake the work that they, the special work that they do. In conclusion, Madam Deputy Speaker, there are multiple and complex issues around the issues of baby loss, and we need to do more to support families through such a difficult experience, but also to reduce the numbers of experiencing baby loss in the first place. It's crucial, and I started at my opening remarks, that we have made some good progress on our national maternity safety plans. We have seen a 25% reduction in the stillbirth rate since 2010 and a 29% reduction in the neonatal mortality rate for babies over 24 weeks gestation. This means hundreds of more mothers and families are going home with a live and healthy baby each year. But as this debate has ably demonstrated, there is still much more to be done. I hope next year, Madam Deputy Speaker, to return to the Chamber during Baby Loss Awareness Week to be able to show the further progress we've made on this important issue.